Okay, no surprise here. The opioid epidemic is getting worse instead of better. Public health officials warn. This is an article that came out in USA Today. It was published yesterday. Okay, a top health official warned Thursday the nation's opioid epidemic is showing no signs of abating. It is one of the few public health problems that is getting worse instead of better, said Dr. Deborah Howry, Director of Centers for Disease Control and Prevention, National Center for Injury Prevention and Control. Howry and public health officials testifying at a Senate hearing described an addiction crisis that has spiraled out of control, that it is far beyond the scope of any particular agency to address. We need all hands on deck, said Dr. Francis Collins, Director of National Institutes of Health. Officials from 4 federal health agencies delivered their dire assessment of the opioid epidemic during the first in a series of hearings before the Senate Health, Education, Labor, and Pensions Committee. The opioid crisis is tearing our communities apart, tearing families apart, imposing an enormous challenge to health providers and law enforcement officials, said the committee's chairman, Senator Lamar Alexander, who is a Republican from Tennessee. More than 11 million Americans misused prescription opioids in 2016. Nearly 1 million used heroin. 2.1 million had an opioid use disorder due to prescription opioids or heroin. Okay, so now we are identifying drug addicts as having an opioid disorder. Okay, I'm going to go ahead and be honest. I'm not going to be surprised to see an opioid awareness month where people are donating money, having all of these walks and everything to combat this supposed crisis that's happening to Americans. It's actually not happening to Americans. We know that it's primarily affecting the dominant society. But let's just move along with this article. More alarming, officials said, is the continued increase in overdose deaths, specifically those involved in illicitly made fentanyl and other highly potent synthetic opioids. More than 300,000 Americans have died of an opioid overdose since 2000, officials said. Preliminary data shows at least 64,000 drug overdose deaths in 2016, the highest number ever recorded in the United States in a single year. At Thursday's hearing, public health officials said federal agencies have undertaken a number of steps to help deal with the problem. They include new programs that strive to improve access to treatment, mobilize resources to increase the availability and quality of long-term recovery, and target high-risk individuals such as pregnant women and jail and prison inmates. Last month, the Substance Abuse and Mental Health Services Administration awarded nearly $46 million in grants to programs in 22 states to provide resources to first responders and those who work directly with people who are at the highest risk. And yet we seem to not be making any kind of progress we need to make, said Senator Susan Collins. Public health officials stress that more needs to be done, particularly in areas of prevention and the overprescription of opioids. Most people become addicted to opioids after receiving the drugs for medical condition. In response, the agency has taken steps in recent months to better educate medical providers on risks and benefits of prescribing opioids. See, they're still, as long as they have a benefit to prescribe these opioids, they're simply not going to stop. You have to think these people are making billions of dollars off being legalized drug dealers, so I don't think there's going to be a solution to this problem anytime soon. Democrats on the committee charged that President Trump administration has delayed critical steps that could provide relief to families suffering from opioid addiction, even as Congress has authorized nearly $1 billion for states to address the crisis. The administration has proposed slashing the budget for substance abuse and mental health programs, allowed the Justice Department to treat addiction as a criminal justice issue, and attempted to end the Medicaid expansion under Obamacare, which would eliminate insurance coverage for millions of Americans with substance abuse disorders, said the committee's top Democrat, Senator Patty Murray of Washington. We should be doing everything we can to tackle this crisis and push for actual results, Murray said. And critical to all that is this administration's being a partner and not a hindrance to our efforts. Next month, the committee will hear from state officials about what they are doing and what resources they need to combat the addiction. I doubt if they come up with anything sustainable because when we had the crack epidemic in the 80s and 90s, the solution was to mass incarcerate whether you were a drug dealer or a user. So we all know that they're not going to do that. So I doubt if they find a solution to this problem. So overdoses will continue to incline or increase over the years because America simply does not want to mass incarcerate its dominant society.